Well, we know how dangerous contact with raw sewage can be, but now new scientific data has confirmed the presence of COVID-19 in human wastewater.
Local 10's Louis Aguirre is in the newsroom with the findings. Louis.
Yeah, Nicole and Calvin, what's really interesting is that scientists have actually been using raw sewage to get a clearer picture of the rate of infection here. What's not known is if the virus can be transmitted this way.
Believe it or not, the flush of a toilet has been giving scientists a new metric for measuring the spread of COVID-19 in Miami-Dade County.
It's been a way to estimate that the actual number of people who have the virus in their system in a given population is actually much higher than what the test results indicate.
Dr. Eileen Marty is a professor of infectious diseases at FIU and a member of the task force advising Miami-Dade on how to come back from the pandemic. At the end of March, the county began sending raw sewage samples taken once a week from Dade's 3 wastewater treatment plants to a lab in Massachusetts, looking for the coronavirus.
To try to kind of determine what the level of infection here in Miami-Dade, it's more prevalent than people think.
So far, the highest reading was measured April 9th. It showed that up to 2% of Miami-Dade's 2.3 million wastewater customers may have had the virus. That same day, the Florida Department of Health only reported 5,745 cases in Miami-Dade County.
It's clear that there's still quite a bit of contamination.
Our aging sewer system is being overhauled, but breaks still happen. A line rupturing near Oleta State Park in North Miami Beach 3 weeks ago, and the record rain we just had resulted in yet another overflow and another swim advisory.
Systems are designed for a certain capacity, but they're not designed for the largest rainfall that can occur.
It really behooves us to get a handle on and make sure that we don't spill untreated wastewaters.
Especially now that South Florida is beginning to loosen restrictions. Miami-Dade beaches set to reopen Monday. The good news is our beaches have never been more pristine.
The data does show that our beach water right now, since there have been so few people in the water, is cleaner than it's been in a long, long time.
In fact, Mayor Jimenez says it's not the sewage spills that contaminate our beaches, but us.
There's a lot of skin cells that come off and rub off on the beach, and that's actually a contributor to the bacteria that we see, and unfortunately when it gets too high, we have to close the beaches.
So as we come back, the best way to protect ourselves and our precious backyard is to keep practicing good hygiene.
I think that people should shower before they go in the water and shower when they come out of the water.
Social distance will be key, even in the water. But as for the threat, the science, not there yet.
The actual absolute risk, nobody knows. And more likely than not, it's very, very small. But again, it's not zero.
But what is promising is that researchers believe that by tracing the amount of COVID found in sewage, once they see those numbers start to spike again, it could be the first warning sign that a second wave of the virus is happening, and they'll be able to tell where those hot spots are a lot quicker than testing. In the newsroom, I'm Louis Aguirre, Local 10 News.
Wow, so interesting. Thank you.